The human nervous system coordinates every action, thought, and sensation. It's divided into the central nervous system, brain and spinal cord, and the peripheral nervous system. The central nervous system acts as the command center, while the peripheral system carries signals to and from the body. Cranial nerves are 12 pairs of nerves emerging directly from the brain. They handle sensory and motor functions like smell, vision, and facial expressions. Numbered 1TP12, each nerve has a specific function and location. The olfactory nerve, cranial nerve 1, is responsible for our sense of smell. It originates from the olfactory bulb and carries sensory information from the nose to the brain. Odor molecules stimulate olfactory receptor cells, generating nerve impulses. These impulses travel to the brain, allowing us to perceive and identify smells. Evaluating the olfactory nerve involves presenting familiar odors to the patient. Damage to this nerve can cause anosmia, the complete loss of smell. Anosmia can result from head injuries, infections, or neurodegenerative diseases. The optic nerve, cranial nerve 2, transmits visual information from the eyes to the brain. It consists of over 1 million nerve fibers, originating from the retina. The optic nerve travels through the optic canal and meets at the optic chiasm. This crossing of fibers is crucial for binocular vision, allowing depth perception. Optic nerve assessment includes testing visual acuity and visual fields. Visual acuity is tested using a Snellen eye chart. Visual field tests check for blind spots, indicating potential optic nerve damage. Cranial, nerve 3, the oculomotor nerve, controls eye movements and pupil constriction. It innervates muscles responsible for moving the eyeball and adjusting the lens. Originating from the midbrain, it travels through the cavernous sinus. This nerve's functions are essential for tracking objects and focusing on different distances. Oculomotor nerve assessment involves observing eye movements and pupillary responses. Tests include following a target and checking the pupillary light reflex. Damage can lead to disorders like ptosis, double vision, and dilated pupils. The trochlear nerve, cranial nerve 4, controls the superior oblique muscle, enabling specific eye movements. It originates from the midbrain and wraps around the brainstem. This nerve's function is crucial for tasks like reading and descending stairs. Cranial nerve 5, the trigeminal nerve, provides sensory innervation to the face and controls chewing muscles. It has 3 branches: ophthalmic, maxillary, and mandibular. Each branch carries sensory information from different facial regions. This nerve is vital for sensations like touch, pain, and temperature. Trigeminal nerve assessment tests sensory and motor functions. Sensory tests involve light touch, pain, and temperature sensation. Motor tests focus on jaw movements and muscle strength. Cranial nerve 6, the abducens nerve, controls the lateral rectus muscle, enabling lateral eye movement. It originates from the pons and travels through the skull to the orbit. This nerve's function is essential for looking sideways and maintaining binocular vision. Cranial nerve 7, the facial nerve, controls facial expressions, taste sensations, and gland functions. It originates from the brainstem and follows a winding path through the temporal bone. Motor fibers innervate facial muscles, allowing us to convey emotions. Parasympathetic fibers regulate tear and saliva production. Evaluating the facial nerve is crucial in neurological exams, especially with symptoms like facial weakness or loss of taste. A comprehensive assessment tests both motor and sensory components. Motor function is assessed by observing facial symmetry during movements. Patients are asked to raise eyebrows, close eyes, smile, frown, puff cheeks, and wrinkle forehead. Sensory function involves testing taste on the anterior 2/3 of the tongue. Sweet, sour, salty, and bitter solutions are applied to the tongue. Damage to the facial nerve can cause impairments from mild weakness to complete paralysis. The vestibulocochlear nerve, cranial nerve 8, is crucial for hearing and balance. It transmits auditory information from the inner ear to the brain. It also helps with balance and spatial orientation. Originating from the brainstem, it exits the skull through the internal auditory meatus. The nerve splits into the cochlear and vestibular branches. The cochlear nerve transmits sound from the cochlea. Sound waves cause the eardrum and middle ear bones to vibrate. These vibrations reach the cochlea. Hair cells in the cochlea convert vibrations into electrical signals. These signals are sent to the brain via the cochlear nerve. The brain processes these signals to localize sound sources. Assessing the vestibulocochlear nerve is crucial in evaluating patients with hearing loss, vertigo, a spinning sensation, dizziness, or imbalance. A comprehensive assessment involves testing both the auditory and vestibular components of the nerve to identify the location and nature of any potential dysfunction. Evaluating hearing typically involves a combination of tests, including pure tone audiometry, which measures hearing sensitivity at different frequencies, speech audiometry, which assesses the ability to hear and understand spoken words, and tympanometry, which measures the movement of the eardrum and middle ear bones in response to sound pressure. These tests help determine the type and degree of hearing loss, if present. Assessing vestibular function focuses on evaluating balance and coordination. Common tests include the Romberg test, where the patient stands with their feet together and eyes closed, and the Fukuda-Unterberger test, where the patient marches in place with their eyes closed. These tests help identify problems with balance and coordination that may indicate vestibular dysfunction. Damage to the vestibulocochlear nerve can lead to various auditory and vestibular impairments, ranging from mild hearing loss to complete deafness, and from mild dizziness to debilitating vertigo. Sensorineural hearing loss, the most common type of hearing loss, results from damage to the inner ear or the cochlear nerve. The glossopharyngeal nerve, cranial nerve 9, is crucial for taste, swallowing, and blood pressure regulation. It innervates the tongue pharynx, and middle ear, it monitors blood pressure and oxygen levels. Originating from the medulla oblongata, it exits the skull via the jugular foramen. It descends along the internal carotid artery, innervating head and neck structures. The vagus nerve, cranial nerve 10, is remarkable and far-reaching. Named from the Latin word for wandering, it regulates heart rate, breathing, digestion, and speech. Connecting the brainstem to organs in the chest and abdomen, it's vital for the autonomic nervous system. Originating from the medulla oblongata, it exits the skull through the jugular foramen. The vagus nerve splits into left and right branches, providing feedback on vital functions. It helps maintain homeostasis and controls muscles for swallowing and speaking. The vagus nerve also slows the heart rate, promoting relaxation. Assessing the vagus nerve is essential when evaluating patients with swallowing difficulties, voice disorders, or symptoms suggestive of autonomic nervous system dysfunction. A comprehensive assessment involves evaluating both the motor and sensory components of the nerve to identify the location and extent of any potential damage. Evaluating the motor function of the vagus nerve typically involves assessing the symmetry and movement of the soft palate and uvula. The examiner asks the patient to say "ah" while observing the upward movement of the soft palate and the position of the uvula. Deviation of the uvula to one side or asymmetrical elevation of the soft palate may indicate vagus nerve palsy on the affected side. Assessing swallowing function is also crucial when evaluating the vagus nerve. The examiner observes the patient's ability to swallow water or food, looking for signs of difficulty swallowing, such as coughing, choking, or a sensation of food sticking in the throat. These symptoms may indicate dysfunction of the vagus nerve, which can affect the coordination of muscles involved in swallowing. Damage to the vagus nerve can lead to a range of impairments, depending on the location and extent of the lesion. Vocal cord paralysis, often caused by damage to the recurrent laryngeal nerve, a branch of the vagus nerve, can result in hoarseness, voice weakness, and difficulty speaking. The accessory nerve, cranial nerve 11, has cranial and spinal roots. It controls neck and shoulder muscles, enabling head turns, shoulder shrugs, and arm lifts. The cranial root starts at the medulla oblongata, exits through the jugular foramen, and joins the spinal root from the cervical spine. Together, they exit the skull and innervate the sternocleidomastoid and trapezius muscles. The sternocleidomastoid rotates and tilts the head, while the trapezius elevates shoulders and rotates the scapula. These actions are vital for daily activities. The hypoglossal nerve, cranial nerve 12, controls tongue movements essential for speaking, swallowing, and manipulating food. Originating from the medulla oblongata, it passes through the hypoglossal canal in the occipital bone. It innervates the intrinsic and extrinsic muscles of the tongue, enabling various movements. These movements are vital for speech, eating, and oral hygiene. Assessing the hypoglossal nerve is crucial for evaluating speech difficulties, swallowing problems, or tongue weakness. It involves checking the tongue size, shape, symmetry, and movement. The patient protrudes their tongue, and the examiner looks for any deviation. The patient moves their tongue side to side to assess range of motion and strength. Damage to the hypoglossal nerve can cause tongue weakness or paralysis. Throughout this exploration of the 12 cranial nerves, we've journeyed from the olfactory nerve, responsible for our sense of smell, to the hypoglossal nerve, which orchestrates the intricate movements of our tongue. Each nerve, with its unique functions and pathways, highlights the complexity and elegance of the human nervous system. These 12 pairs of nerves, emerging directly from the brain, serve as vital conduits, carrying sensory information from our environment to our brain for processing and transmitting motor commands from our brain to muscles and glands, enabling a wide range of actions and responses. Understanding the anatomy, functions, and potential impairments of these nerves is paramount for healthcare professionals, especially those dealing with neurological conditions. A thorough cranial nerve assessment provides a window into the health of the brainstem, where most of these nerves originate, and offers valuable clues about the location and nature of potential neurological lesions. From the subtle scent of a flower triggering memories to the intricate coordination of muscles allowing us to speak, sing, and swallow, the cranial nerves play an indispensable role in shaping our daily experiences. Their intricate connections and interactions underpin our ability to perceive the world around us, communicate with others, and maintain vital bodily functions. The knowledge of cranial nerves is not merely confined to the realm of anatomy textbooks. It has direct and significant implications for medical and speech pathology practice. For medical professionals, understanding cranial nerve functions and potential impairments is crucial for diagnosing and managing a wide range of conditions, from head injuries and strokes to brain tumors and neurodegenerative diseases. For speech-language pathologists, a deep understanding of cranial nerves, particularly those involved in speech, language, swallowing, and hearing, is fundamental to their practice. Assessing and treating patients with communication and swallowing disorders often hinges on identifying cranial nerve involvement and tailoring treatment strategies accordingly. By recognizing the signs and symptoms of cranial nerve dysfunction, healthcare professionals can make informed decisions about appropriate referrals, diagnostic testing, and treatment interventions. Early detection and intervention are often crucial in mitigating the impact of cranial nerve disorders, improving patient outcomes, and enhancing their quality of life. As we conclude this exploration of the 12 cranial nerves, let us marvel at the intricate workings of the human nervous system and appreciate the profound impact these nerves have on our ability to sense, perceive, communicate, and interact with the world around us.